Pat Tinsley is a well-known GAA photographer from Newbridge, County Kildare, who suffers from a rare genetic illness. The disease has caused his weight to plummet, with normal daily tasks now leaving him exhausted. Pat wants the HSE to approve the use of a new drug, which he believes could halt the progress of this illness. Good morning, Pat. We know you're going through such a difficult time at the moment. Can you tell us, what was life like before you were sick?
Well, I was a very busy photographer, running up and down football pitches, taking photographs of all the action. I was as fit as the guys on the pitch, but gradually over a number of years, this illness took control, and I just wasn't able to do it anymore.
I mean, it's so difficult because you're so well known in the GAA circles and sporting circles around Newbridge, and so many people have seen you supporting alongside, and to know that you have this illness is so difficult. Can you tell us a little bit more about the illness?
Well, as you are aware, it's called amyloidosis, and there are different forms of amyloidosis, and I've got a very rare one. It's called HATTR, which is hereditary amyloidosis.
And can you tell me, how has this illness, how has it impacted you and your body?
The big danger to me at the moment is my heart, because of the cardiomyopathy. I've got a very enlarged heart. I sleep very long hours, extreme fatigue, can't walk more than 50 yards without stopping, catch my breath. Luckily, I can still drive, so I can get around that way. So it's the last pleasure I think I've got left.
Pat, there is hope, and there is a drug out there. Can you tell us about the drug that could potentially save your life?
Well, the drug is called Patisiran, and it has been trialled for a number of years now with great success. And it has been approved in the US, in the UK, and certain European countries, but still not here in Ireland. Symptoms have been relieved up to 80%, and in some cases, symptoms have been reversed. The disease has been reversed in some cases.
Can you tell me, Pat, because I know this drug, it costs nearly €500,000. You know, so it's a difficult decision.
I wouldn't go. Sorry, Tommy, I wouldn't go so far as to say that amount of money. Like, that certain amounts have been quoted in the media, but they're just list prices. I think there are negotiations going on between.
Okay, well, what would you say to the HSE? Because obviously there is a huge constraint, and money is so tight within the HSE, given the crisis that we're in at the minute. I mean, what would your message to the HSE be to try and get a hold of this drug?
I want the HSE to keep me alive long enough to be able to benefit from these new techniques. And I don't think a cost should be a factor in saving my life.
Absolutely. Well, join us now is Dr.Mark Coyne, a consultant haematologist at the Mater Hospital, a leading expert in Pat's condition. Good morning to you, Mark. How would this drug, Patisiran, help Pat?
Come again, Tommy?
Sorry, how would this drug, Patisiran, help Pat and his condition? What difference? You know, we've seen how difficult it is for Pat at the minute. You know, is this just a miracle drug that could save his life?
I suppose to maybe step back a little bit and to speak about the condition. It is a rare condition, but it's a condition that's endemic or found in Ireland. It is found around the world, and it does affect the person's body exactly as Pat has described, both the heart and the nervous system. For a long time, as a clinician working with expertise in this area, all we could do was manage the symptoms that the patient had. So if their heart wasn't working, we could try and manage the symptoms that the patient had relating to their heart, or if their nerves, the electricity, the electrical circuit going around their body, if that wasn't working properly, we could manage their pain, we could help them walk a little bit better. So they were the things that we could try and do to manage their symptoms at that point in time, what we would call supportive care. In the last 5 years, there really has been a revolution in treatments that are becoming available for rare diseases, including ATTR amyloidosis, which is the type of amyloidosis that Pat is talking about. Patisiran is one of those drugs. There are other drugs, inotersen, there are other drugs that stabilize the protein called tafamidis, and there's other new technology where you're able to edit out at a genetic level the problem gene to remove the condition fully. So in particular, going back to the drug that Pat has mentioned, these are what we call molecular drugs. They target the problem at a molecular level. They are put into the body and then they stop the production of this protein that then is then made into amyloid, and that amyloid is put into the heart and the nervous system. So really these drugs are very good. I've experience using them. We have 5 patients in the Mater on these drugs, and all of them are doing very well on the drug. So yes, there are drugs, and certainly it could help Pat.
So there are 5 people in the Mater who are getting this drug at the minute, but unfortunately Pat hasn't been allowed to get it at the moment. Are there cheaper drugs coming on that potentially could be given to Pat, or what way do you see things going?
So I suppose I don't really get into cost. I suppose with new drugs and new technology, and we're all very experienced in the process now that different drugs go through, because we've watched attentively waiting for vaccinations to become available. So we saw that, like the federal drug, FDA had to kind of approve it in the US, the European Medicine Agency had to approve the vaccines. So equally with any new drug, you have to achieve approval within the region. And then within the region, which Ireland's within the European Union or within the remit of the European Medicine Agency, it has to then go through the process of the HSE and the NCPE to evaluate how does this fit within Ireland's health service. I've provided information to the HSE on the drug and NCPE, but I'm not privy to knowing the ins and outs of when it be approved. I think it is important to say, though, that you should let this process continue, because it is in the interest of our population more broadly that this process is done in a way that's not interfered with in any way. So is there a cheaper drug? I would say as a comparator, there really is no comparator. We did try transplantation many years ago, where we would transplant the person's liver for a person that did not have the condition's liver, but that didn't work. Unfortunately, it actually made the condition worse. So we've been for years trying to stop this disease, but the molecular technology, like the drug that Pat has mentioned, patisiran, inotersen, like the CRISPR technology that may come on stream in the next 10 years, all of these are using the advances in science to change this condition, but they are expensive, unfortunately.
Absolutely. Listen, I'm sorry, Dr. We're running out of time here. Listen, thank you so much for coming on this morning. We wish Pat all the very best, and hopefully he can get the drugs that he needs to continue his recovery. Now, still to come this morning, it's been a year since COVID-19 changed life as we know it, and at 8:15 we'll be finding out more about how we can continue to keep our little ones informed in a way that won't frighten them.